video, let me talk about the importance and the implications of sociology in the nursing. Sometimes they may ask you sociology and the nurse also, so you have to write the related points in that. So, sociology is very important and relevant to the nursing practice because we deal with the patients. According to the Twaddle and the Hesslers, for the students in the healthcare professions, might be a medical student, might be a nursing student, otherwise might be a paramedical students. Okay, so the students in the healthcare professions, there's an important practical reason for them to understand the sociology of health because we deal with the patients. Parsons. So, the parsons are the chief priest actually. Okay, so what do they say? They say that because of the importance of the social environment is the place where we live in. Because of that, to understand the etiology of the illness, etiology means it is the causes of the illness. The cause, illness means disease, which may be due to the microorganisms or society. Or the second is in favoring or hindering, stopping the maintenance of good health. Okay, and thirdly, favoring the recovery from the illness. These all depends upon the society, the people who we live with, whether family or neighbors and other people. So the illness we get, it's because of the causes of the illness, all because of the society. And second is uh, whether we maintain a good health or whether it favors or hinders, it's all because of the society. And even if we get illness also, recovery from that also, it depends upon the society. So all these depends upon society only. Hence there is a very great need for sociology to be trained among the health professionals. So, what is the role of the nurse? Nurses play an important role in the healthcare profession. Obviously, if no clinics, no nurses, no hospitals. They work toward the maintenance of the healthier societies. Might be a child health, or adult health, might be elderly health. It all depends. It depends upon nursing care only. Okay, in coordination with primary, the secondary, or the social institutions. Nurses must cooperate to enable the implementation of the healthcare facilities and other national healthcare programs. So, primary, okay, in coordination with the family, primary might be the friends, the or secondary relatives, otherwise like a school, something and all. Okay, the primary, secondary, and the social institution is more important. In coordination with them only, nurses must cooperate to enable the implementation of healthcare facility. This it is impossible if you're not going to involve all those people. Okay, even if government of India is providing a lot list of this thing, this has to be provided. So you need a society to cooperate so that this healthcare facilities uh, which is being approved by the government will be reaching them. And other national health programs also might be, it might be a vitamin A program, otherwise like a tuberculosis program, any program it matters. So all things will come through a nurse to the society. So that's why she needs to rate this. Okay, as a role of a nurse in sociology, it deals with 4 points. Number one is a manager and the supervisor. As a manager, a nurse should act as a community organizer and she's a leader in planning, organizing, implementing what? Health services through the community participations. Okay, if the community has to participate and she has to plan, organize, implement health services. Second, she is a planner. Planner for what? She should plan and provide a proper nursing care according to the patient's culture, beliefs, and the practices. And especially in community, she's a supportive supervision, especially by the community health nurse, is required. And she's a researcher too. She updates the skills, knowledge, and monitors and evaluates activities in the nursing field and as a part of her research where she can undertake that. She analyzes the health conditions of the people and she brings about the changes, innovations in the healthcare, and it all depends upon the research. For example, in olden days, The umbilical cord care was given by turmeric, otherwise some oil or something like that. So that all is a bad practices. She is the one who took initiative in changing all those uh, bad behaviors towards the health. She is a social scientist because humans are a member of a society and therefore the behavior may change. Smoking is a very bad habit. It is very difficult to change them. So she's a social scientist, but still she tries her best to do that. And that is why it is required for the sociology in nursing. Nursing requires knowledge of cultural aspects of the health service. It's very, very important. Certain culture says no health service, I mean especially no tubal ligations means um, family planning, so they avoid that and they refuse that and you can't force them to do that. Okay, so you need to have a knowledge related to them and modes of predictions. You need to understand what is going to happen in the future if they're not going to do, if they're going to follow something right one. And the social structure is more important, from the top till the bottom. Who's going to be the person who's going to take care of the patients and the family? Okay, the social structure is more important, and distribution of the power in the family. All right, and not only there, in the working place too, it is more important, and especially the political organizations also, which is going to help in the healthcare systems. So all these things she needs to have an update knowledge. Importance or uses or applications of sociology in nursing. So you may get a separate topic, write the importance of sociology in nursing, otherwise uses of sociology in nursing or applications of sociology. Any question matters is the same answer you could write. Bedside manners are must in all medical fields that deal directly with the patients. Yeah, almost not all the patients, but many patients require admission so that they can stay in the hospital and they need to be taken care. So nurses must understand the various structures of the society in order to clearly hear someone and understand the thoughts or the feelings. It is more important. We need to understand, especially in certain interior villages or rural places where the women are vulnerable group and none of them hear their voices, even if they cry too. So when they come to the hospital, it is our duty to listen to them and understand their thoughts or the feelings of them. It's not only them, even the poor people are also being ignored. Sociology teaches nurses how to relate to patients and co-workers, doctors they work with, so that everything is interlinked. If one is going to fight, and the link will be closed, and there'll be a again the healthcare is the main goal will not be provided. So sociology helps nurses to understand the patients in a form of a group or in a community perspective. Means uh, some people are vulnerable, so you have to think about the community, what they do it and what they think about it. So in that way we are supposed to deal with them. And there are more I mean these are important because besides the medical knowledge, a nurse needs to be kind, sympathetic and compassionate. So the information which we get it by the superficial study in those fields will help every nurse to be kind, gentle. The main importance of the application of nursing is to be able to provide a holistic care. It's not an individual, and we provide as a whole. Means if it is going to be a pediatric care, I mean a child has been affected, so we involve the family members also, the mother and the society also, and we involve totally together. In that case, we need to know about the sociology. A nurse is expected to be able to encompass means include not only the physical well-being. It's more important for the illness to be cured, you need to support for the physical well-being, but still the patient needs psychological support, spiritual support and familial well-being also. um, that is why you need sociology to understand. Sociology makes nurses more aware of differences between the cultures and the groups within a culture, and thus making them more sensitive to the factors of importance. Nurses must reduce race and religious prejudice. Race means dark people, white people. So nurses should reduce it. right? And religious prejudices means prejudices is nothing but a preconcept, predetermined thoughts. Okay, religious related to. So we should not have that. We should reduce that to follow their professional morals, ethics. It's more important to understand them. For that, understanding culture is important, groups, community. So this will be very helpful. Sociological knowledge plays a major role in shaping the attitudes of the nurses in their profession because we deal with different kind of people, co-workers, all are from different societies. So we need to understand that. Understanding the sociological implications of the patient's life can make for a significantly improved nursing care plan. So the one last aim is a good health care. It all depends upon uh, knowing about the society. Sociology can be of a value to the nurses to enable them to question the values and the beliefs of their profession and the organizational context in which they work. Certain cultures have a definite needs as to how medical services are provided based on the cultural practice and the religious belief. Some people don't even bring patients to the hospitals, even if they're going to be very sick. They believe that God will heal them. So, in that way, we have to know them and understand them. Having the knowledge and understanding to take these things into consideration is a form of a respect to the patient and may well aid in the healing process. So, we live in a society where, due to the socioeconomic pressures, certain illnesses and conditions can be peculiar to a particular social class. Might be some diseases like malaria is endemic to one place where there's no cleaning at all, and some places there may be a cholera, so that might be unhygienic practices or tuberculosis because of poor socioeconomic status. Okay, it's all because of that. So we need to understand that too. Understanding the background and the social structure that a patient comes from and affects the way medical staff interact with the patient, that also matters. Today, nurses are critically involved in making sense and giving purpose to the life, illness, and death. So, the nurses has to be sensitive to the health needs of the people in the context of the broader social change. So, knowledge of sociology helps the nurses provide a total patient care in a comprehensive manner and work with their families just to provide the health counseling and plan for providing a continuity of care. So, how do you get the questions like this? They may ask you write short notes on application of sociology in nursing, uses of sociology in nursing, importance of sociology in nursing, and nurse and sociology. These questions are being asked in some universities. So please see the description for the further topics.